Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel.
Okay. So first thing first, my name is Kento. I am a physical therapist and a clinician at Tenafly, New Jersey. You already met Danny. He's also a physical therapy assistant and acupuncturist in our company. You've already seen him. He's kind of waving around. So if you are in this webinar, you're here to learn the secrets to improving your chronic hip pain. So there's a lot to do with chronic hip pain, but I just kind of try to condense certain things and have a lot of videos and pictures. So there's a lot of content here today, and it might not be the best looking PowerPoint, but there's a lot of good content in here. So hopefully if you get anything out of it, 2 or 3 things, that'll be great. Before we get started, a little bit of housekeeping here. If you look at it, this is called the GoToMeeting app. At the bottom of your screen, it might be a little bit different because I'm on the actually shared screen right now, but there is an icon that has a microphone icon. And if you see a microphone icon, please keep yourself muted because we are in recording. So to keep the audio nice and in good quality, we want to make sure everyone's muted. You are welcome to join by turning your webcam on, just in case you ask any questions later on. We'll love to see your face. If you don't, no worries. I totally understand. And we'll keep going with it. Oh, we got a good amount today. Also, there is a chat icon. So same thing, this might not be the perfect representation of what you are currently seeing in your screen, but if you go to the right-hand side probably, or where the icons are, there should be a chat icon. And if you kind of click on the chat icon, you'll be able to put some type into anything in the chat. So as I am going through the PowerPoint, feel free to ask any questions because we're going to have 2 intermissions today, meaning there's going to be one point where we're going to answer any questions, and at the end we're going to answer any further questions after we give you some exercise that could help with your chronic hip pain. So Danny's going to kind of monitor me and also kind of put me in check, if that's okay, Danny. And that'll be great. So if you sign up for this, hopefully it's something related to your chronic hip pain. So if you're in the right place, if you have some form of chronic hip pain, let's say you have this outside hip pain, I'll use my model here. If you ever seen the video that I have, it's if you have pain in the outside of the hip, or pinching pain in the groin, the front of the groin, or this deep buttock pain, you are in the right place because that's what we're going to discuss about in common patterns of it. If you do have sciatica pain, this is also a pretty good position. I'm not going to discuss anything about herniated disc, but sometimes the hip is related to sciatica issues. So this is a great one to try. If you have pelvic floor issues, so if you do have anything such as incontinence, diarrhea, you are constipated, or just in general have digestive issues, those individuals tend to have hip tightness or issues. For individuals that had kids, post-pregnancies, because your pelvic floor got too stretched out or your abdominal got too stretched out, those are things are all related to hip issues as well. If you have scoliosis, this is a big one as well because you tend to have one hip higher than the other one, and these are good exercise or things to look into. If you feel weak in the hips when you're doing yoga, or like when you're doing golf, if you feel weak in the hips, this is a great one to look at it as well. So I'm just giving examples of the things that we tend to see when it comes to chronic hip issues. Oh, I see someone over there. And then if you are a person that have gotten MRIs from doctors and was told that there's nothing wrong in the MRI and still have hip pain, that can happen. And we are going to talk about these phenomena as well. If you have hip pain with other issues such as knee, ankle, and hip, or you have other issues along with the hip, this is a good sign. Or you've done so many glute exercises, you've done so many hip stretches, and you still have these issues, you are in the right place. Glute exercise is not always about the right thing to do, but because it's a big muscle, we always do it. We love to work on those hips. If you've done massage, your hands-on work all the time, and you get these short-term relief acupuncture chiropractic, but you don't get anything to progress enough, this is the right place for you as well, because many times the people that we see in Kamiyama PT are people that progress a little bit but never progress further. And you don't want to rely on surgery, medication, massage. And lastly, that I hear all the time, you were told that it's in your head. What a terrible thing to hear. But I hope that's not the case for any other one of you. I hope none of you heard that. But some people we have heard that it was all in your head, and it's really tough on the individual. So if you are those, that's the case. For those that are here or those that registered, we had about, I think, close to 36, 37 registrants, and about 2/3 of you did the survey. So that was great to see. So about more than half of you have a hip issue. Some of you have a low back issue, and some have like muscle injuries from sports. And one or two, like I think a 5% of people that they're not sure. Within this group, I kind of wanted to see what's going on, so it's a better idea what I need to kind of adjust to. Is many of you are scared of losing mobility and independency, which should be a huge thing, which I'm happy to hear. So with the exercise, I think you'll have a great time, or at least you'll get something out of it. A good 35% of you not sure what's going on. So if you're not sure what's going on, we're gonna talk about big habits today, meaning big patterns. So it might not be completely individual to your pattern. So at the end, stay along. If you want kind of the individual assessments or just to kind of figure out what's going on, just stay along to see if you can, if you'd like to get anything beyond that. One was risk of dangerous surgeries, and a couple people don't want to depend on that painkillers because you can kind of get away from pain by taking painkillers. How long have you had this? A majority of you had it for too long or long enough. So hopefully you guys get something out of this. And then for whatever you guys want, what do you guys want to achieve? Most of you want to know, find out what's wrong, right? So that's most of the time based on individual assessment, but you'll see some patterns today. Get active again, ease pain, and most of you just want to stay healthy and fix it before it worsens, which is one of the best things to do, right? And how serious are you? Most of you are very serious about this. Some of you are kind of 2 or 3. You're not kind of, hopefully that's great too. That's no problem. I'm glad that you guys are taking to it. Take whatever you need to from here. But for those that are 4 steps forward, so just find that are very serious, just kind of stay up till the end and make sure you get a little further things that you need to get. So what are we going to cover? I made the numbers 5, 5, 5. I should have done 7, 7, 7 because today's 7, 7. I totally even realized it. So we're going to talk about 5 secrets why people with chronic hip pain doesn't get better. There's more, but I'm just going to put 5. 5 common body habits that we see in our clinic a lot, and 5 simple things you can do to make the changes to these common habits. Right? So we're going to get going, but before we get started, I want to make sure there's this health advice disclaimer. I just want to make sure these things going on. I am giving you these generalized things that we see in our clinic, and we're trying to make it as accurate as possible, but this is not an individual assessment nor individual plan of care. So please note that, and just make sure you see a medical professional if need be. A little bit about our team. This is Danny here. Danny, just wave. I know you already said hi to everyone here for people that came along. He's a physical therapy assistant and an acupuncturist. He's also an adjunct professor at Seton Hall University. I would say he's the best of both worlds when it comes to Eastern and Western medicine. Phenomenal clinician. So when it comes to looking at things as big picture and also working together with specific stuff, Danny's the guy to go for sure. Also, if you have any trouble with cars, he's the best guy to go for fixing cars. He's fixed my car tons of times and saved me a lot of money. So just a little side gig for Danny if he ever wants to do it. And of course, he does spend time with his wife. A little bit about myself. I am the founder of Kamiyama PT. I love treating. I'm a husband, I'm a father, I'm a clinician, I'm a teacher. I'm a former national lecturer and international lecturer for a couple times, like teaching in Japan and also kind of teaching nationally as well, and also teaching the university. My teaching time or amount has decreased a lot since my 2 kids, so I can spend time being with the family more. But I still love to teach, hence why I'm doing these kind of things. And of course, I love to spend time with my kids and my wife, always, always. Never forget the wife, right? So my kids love Minions. I hope you guys are as excited these Minions. Let's get started. So let's go first into the 5 secrets on why the hip is not progressing for you guys, or some of you. If you have any questions in between, please let me know. All right. Number one, stress is related to your pain, right? When you stress, the reason, so this is the thing that I'm going to tell you, right? Many people think, oh, I'm stressed, but it's not related to my pain. It might not be a direct relation, meaning it might not be the direct cause of it, but it has a huge effect on it. So when you stress, right, a hormone called cortisol comes out. And what they're finding out with a tissue called fascia, which is all over the body, they're finding out that the cortisol increase also relates to those fascia or tissue thickening. They get tighter, they get denser. So it's not a bad thing. When you get stressed out, right? Have you ever had a time where you're so stressed out at work or you did something and you feel tighter that day, right? This is a protective mechanism that's happening into your body. This is not a bad thing. This is not a bad thing, guys. However, if you are unaware of your stress and you forget how to regulate your stress, that is when it becomes the problem, right? So I'm trying to put it in layman's terms. If your stress is unchecked, your body gets tight. But if you realize, like, let's say you're stressed and you work 24 hours a day, I hope you're not, but let's say you work 13 to 14 hours a day for 5 days a week, and you keep going, let's say you do for 10 days a week, 16 days a week, your body's gonna keep getting tight because you're not able to regulate your body or stress that will relate to it. And common areas that gets tight with stress are your low back, your neck, your outer hips, and calf area. These are common areas. These are areas that are very dense in tissue if you actually get into cadavers. So those are the areas that get really tight. Right? So the cool thing about this is a little picture I want you to guys see. You might not be interested. I'm just interested in kind of stuff. So in a very microscopic way, there's tissue. And if you look at the top right, and I put it healthy tissue, I don't know if you guys can see it, you can see how it's kind of spider webby, and it's a little shiny. If you guys can see the picture, I'm sorry if it's not clear, because it's like in this 2 nanometer microscope. And that's a healthy tissue. So healthy tissue are very granular. It's very spider webby. It's very unorganized in a sense, and it's very shiny. It has a lot of water to it. When it's unhealthy, let's say it's very stressed out or scar tissue or a healing tissue that has not healed very well. If you look at the one on the bottom, this is how it looks like. So the bottom picture on the right is called dysfunctional tissue. And if you can see it, it's very thick. This is about the same zoom. It's very thick, and you can notice there's not a lot of water to it. So it gets really dense and tight, right? So if you notice when you're really stressed out, or let's say you're tight or after scar tissue, you can notice yourself being really tight. This is what's happening. And because of this tension and like how thick it is, it's really hard to kind of slide and glide your muscles and how you move. So stress is related. It doesn't mean it's the cause of it, but there's a relationship to it. So if you've had chronic hip for a long time, or hip issue for a chronic amount of time, which is a long time, this is likely a chance of what's happening, and it takes a little bit of time to change the tissue. Number 2 secret is you need to work more than the hip, right? Danny, as an acupuncturist, will tell you probably 1,000 times, maybe not 1,000 times, at least 3 or 4 times, let's say, where if you are only working on the hip only, we might be missing something, right? If you ever sang the song, I never did because my parents are Japanese and they spoke in Japanese, so they maybe had a Japanese version of it, but the thigh bone connects it to the hip bones, the hip bone connects to the pelvic bones, the pelvic bone connects to your spine bones, and I'm just making it up as I go, right? But these things are connected for a reason. So if the individual is being just looked at the hip because the hip just hurts, we might be missing the point. And I'll say more the reason on that on number 3. But many times the hip is related to a low back issue, a pelvic floor issue, your knees, ankle, foot, rib issues, or core issues. You'll be surprised how many things change a hip. Number 3 secret, these are all kind of interrelated. Hopefully you're starting to see a point here. You don't want to ignore your medical history, right? So if you had chronic hip pain, so you've had it for such a long time, and if you come to us, hopefully we've listened to your medical history and we try to make connections with it. Sometimes we forget or just miss it. So we just need some reinforcements for the patient. But there's a commonly forgotten medical history, especially with hips, is ankle injuries. So if you had ankle sprains in the past, let's say you were playing soccer when you were, I don't know, 12 years old and you had a really bad ankle sprain and you never rehabbed it, because back in the day, it was about walk it off and just walk in and you'll be fine, right? That was my day. And I was in a booth for like 3 months once and I never rehabbed it. And you'll be surprised how an ankle injury restricts how much your hip actually works, right? So just kind of making sure if the therapist or person that you're working with listens or hears your medical history and sees if there's a connection to it, I think that's a very, very important part, right? I'm sure Danny will agree with me, because he'll kind of like talk to other people and be like, oh, oh, that's a big missing piece that might be a key thing for your hip issue, right? Other things are like digestion issues, any kind of digestion, urination, pooping issues you might have. Those are a good thing to talk about, because that does affect how your hip and your pelvic floor is literally next to each other. Past surgeries, maybe you've had C-sections, maybe you had a back surgery, maybe you had prostate, cervical cancer, and you have to kind of do prostatectomy. Knee, ankle surgeries, those all matter. The point is just make sure you talk about your medical history. That's the whole point. Because I'll give you a quick video, which is pretty cool. I'm not gonna give you a huge, like, complete medical history of it. I'm gonna play here real quick. And this is a young adult that has left hip issues. All right, so this person has told me that he came in for left hip issues. So just check here. I'm trying to rotate his hip and it's really restricted. And then hip flexion is very restricted. Then suddenly he goes, oh, I had this right ankle sprain that I had a chip in, I chipped my bones. So he lacked pronation on this side. So I'm just narrating here. I noticed that he can't rotate his bones a certain direction on the right leg. I've been working on his left hip. And he finally just told me recently. So I just kind of tested it. So let's do about 4 or 5 here. And that also means from an exercise standpoint, you need to rotate and pronate the ankle. All right, so I'm kind of putting this first person's foot into pronation and internal rotation of the tibia for whoever is our clinical. But after I did, I don't know if you see it in this angle, but he got about 40 degrees extra range. And if you see range of motion and flexion, you can tell how much more they had compared to before. So I can explain this from a mechanical perspective, but that's not the point of it. Is the whole point, the reason I took this video is when an individual tells us a medical history that may have relationship to the issue they have, as much as I can, I will listen and try to see if that is connected. And if it is connected, there's a good chance that we want to incorporate some form of exercise to help that hip that you might have. So this is just a video to just show you that it's kind of possible that it's connected. That's, even though a farther away thing can have like quick changes into something that has been a chronic thing. Just want to make sure, Danny, was the video quality okay with that one? We're good? Good, okay, awesome. Awesome. All right, number 4. Everyone has a mind of one's own. This is something I've learned from my mentors, which is very helpful for me, because I used to be this mechanical guy where it's like, okay, you got to do it this way and this way, this way, and everyone's going to get better. What they didn't tell me often is the fact that everyone has a different learning process. And very often what I realized, and myself included, is I was always worried if I was doing the right or wrong thing. Right? So because I'm always like, oh, did I do the right thing? Did I do the wrong thing? I get off course of what's the reason or the bigger picture. You have this bigger picture or goal that you need to have, but you just have to allow your learning process to process it slowly but surely, and kind of go through these kind of mistakes and successes as you go to where you need to go. So what's really important for you, I think, for individuals that are still suffering, is to find what works for you and the therapist. And I'm learning as I go as a person all the time. As a father, I'm learning how my son and daughter is learning, right? It's interesting. And I'm expanding how I teach and how I learn and listen for people. I'm ever evolving. So, you know, I look at individuals and say, you know, are you a better visual feedback person? Are you tactile feedback? Do you better reading? So should I recommend you a book? All right. Or what are your past experiences? So how can I relate to your story and experiences? And this is not something I did all the time, if I'm being honest. I'm just trying to learn a little bit more as I grow and listen to other individuals. So, you know, let's say, for example, if you played soccer and you're such a soccer person, if I relate it to a soccer example, you might understand what I'm talking about when it comes to hip. So if I say, if you cut between go to right or left, they might understand the movement. Or if I say, if you kick with your laces, this is how I want your ankle to be. Those are some examples that might help out, because most of us learn a little bit differently. Just because I said, you know, let's say flex your wrist, you might flex it this way, and some people might flex it this way. We just never know. So, you know, change takes time. So be forgiving and patient with your process. You know, it does take time, especially if you're in chronic issues. You kind of want to change slowly, not complete it fast. Number 5 is how to put the fundamentals together. So yes, I told you everyone learns a little bit differently, but we do want to go to a certain extent. So everyone needs to have some fundamental stuff. So there are fundamental things that we want to improve for the hip. A couple things are learning how to load the hip and unload the hip to make sure you can walk and run, right? To make sure the hip works well with adjacent joints. So let's say it's working well with your lower back, working well with your knee and ankle. And breathing. So those are certain things that we want to improve. And the reason I say this is, yes, I just said in number 4, learning process. Everyone learns differently, but we want to make sure we're all going to the goal, the bigger goal that we're going for. So, you know, I put in examples for dyslexia individuals is just because the person can't see the letters differently, you're not gonna not teach them alphabets. You're still gonna teach them alphabets. You're still gonna teach them how to read. They just learn differently. So the end goals were all in the same direction, but we're making sure. So we have different learning processes. Those are some 5, 6. There's a lot more. There's a lot more, to be honest. There's some granular stuff, but I hope you got something out of that for some of us that you're here. If you have any questions, feel free to put it in the chat. And if you got anything out of it, make sure you type it in there too. We're going to go into the 5 common body habits in chronic hip pain. I think you'll like this one. I put a lot more pictures into it. The first one is the butt clencher. So when you look at the picture here, there's a left one and a right one. The lady in the left, if you take a look, it's kind of in the upside down V. So I'm kind of, I'll draw a pen here. So if you take a look at, it's an upside down V right here. Right. So if you take a look at this lady's, like, you know, glutes and butt, it's fairly relaxed, right? And then you can tell that her low back is kind of relaxed. Now I want you to look at the guy on the right. I'm assuming it's a male, right? See how the t-shirt is creasing here? And his butt, so they're doing a V because the glute is so squeezed hard that they're in that position. If you're a person, someone, right, and that we're told from someone, and that even though you're a butt clencher, like everything turns your butt on, right? And you did a lot of glute exercise to help your hip, but it hasn't improved. There's a very good chance that you're a glute clencher or butt clencher, right? So if you do, oh, apparently I'm breaking up a little bit. At what point did we get lost? Should I go back to do the PowerPoint of the butt clencher real quick?
You've been clear for me.
Okay. So I don't know. Oh, cool. So I'm assuming it's the other person. So it's been good so far. So let's keep going. So if you have a tendency to kind of, when you're doing any kind of exercise and your glutes kind of squeezing all the time, there's a good chance you're overutilizing your glutes, right? So that's one habit that we see a lot with the chronic hip pains. All right, hold on, let me take that out. Number 2 is the anterior tilter. The anterior tilt meaning is the pelvis position. So if you take a look at the man over here on the left-hand side, can you see how his back is arched? So that they call that an anterior pelvic tilt. So basically means when your pelvis, and if you can see my screen here, this is the pelvis right here. And when the pelvis, and this is the front, this is the back, the pelvis just tilts forward a little bit. And when the pelvis tilts forward, the space here gets decreased. So when you actually try to lift your leg up, there's actually less space in your hips. And that can create issues in the hip joint area. Like if you want to test it out for yourself, you can. Like if you're in sitting position, you can do it right now. Is to try to lift one of your hips up. Let's say, make sure it doesn't hurt. Like I don't want to hurt any of you guys. So let's say you lift your hip up, one of them, right? And then not really, just arch your back and try to lift it one more time. You'll probably feel a resistance. And it's not because there's resistance, you just have less space to go. And imagine you're in that position all the time. How your hamstring is going to work, how your hip flexor is going to work, they all change. And if you can't change that position, it will lead to probably more long-term problems. This one I love because it's not something we all talk about. For some that may have treated with us, you may have heard it for us, is the ab over gripper, right? So you probably heard from maybe trainers, or you've maybe done yoga or Pilates, and you've heard that, you know, you get the core, right? But there's specificity to that, right? So people can over grip the core, right? And so let me explain. So if you take a look at the lady here, and you can see the black arrow here, if you take a look, the rib bone's kind of around this area, you can see how it's kind of caved in. So I'm kind of drawing right here. You can kind of see how that abdominals are caved inwards, right? What that means for me, or Danny as well, is that individual, when this individual does any kind of planks or ab exercise, they would primarily feel their six-pack abs or eight-pack abs, whatever you have, right? So if you have the six-pack ab, you're always feeling the six-pack abs, and you still feel low back issues, you still feel hip issues, you still have pelvic floor issues, there's a very good chance that you overgrip with your six-pack abs. I hope that made sense. So if you ever done an exercise in your abs, there's a thing called obliques, which is on your side of your six-pack abs. So those are the ones. So let me do a drawing here. I'm talking about the obliques are here, the sides of your abs. Those are the ones most of the time these people do not feel, because these are the ones that helps you kind of shift from right to left, and also actually really stabilize your whole trunk much more. Your six-pack is only kind of like two lines in the front, and that's the only thing they really hold on to. So if you're an ab over gripper, this could be a reason why. Right? So I hope these things that you guys are hearing right now is somewhat interesting for some of you, hopefully. Oh, sorry, I'm just reading the chat as well. So if you are an ab over gripper, there's a good chance that you're just not letting go of the abs. You know, abs are great. There's no question about it. But if you over grip it, it doesn't help many of us. Good. So I'm seeing questions. We're going to actually answer the questions as I go. Danny, just monitor that as well. So number 4. So it seems like some of the habits people are starting to see, which is good. Number 4 is breathing. Huge, huge, huge stuff, guys. If you're a chest breather or a stomach breather only, this creates problems. So there's a lot of videos. So hopefully you're getting something out of this here. But I'm going to make a video here. I'm going to play the video. And this here, the first one, I'm just doing chest breathing. And if you take a look at when I'm chest breathing, and I'm going to see if I can stop. Hold on. So if you take a look at me chest breathing here, when I breathe into the chest, can you see how my back arches a little bit more? right? And when my back arches, if you notice the number 2 body habit, I anterior tilt my pelvis. And just by doing it, and I'm not going to go into too much mechanics, my hip flexor in the front gets tight, my outside hip muscles get really tight, right? These are things that could lead to a position where it doesn't help my hip keep mobility, all right? And I'm going to just keep the, oops, hold on. Sorry, guys. There you go. Now, this is when you're a chest breather, right? And now I'm going to go into stomach breathing. And if you have taken maybe yoga, and I'm not trying to blame yoga, it's when it depends on how you learn something. I was like stomach breathing for a very long time when I learned some things that said, okay, I do stomach breathing because diaphragmatic breathing is better for me. So I did stomach breathing like for so long, and it does relax you if you've never done it in the past, but it doesn't necessarily, at least for me, hasn't built me, right? So if you take a look here, when I'm breathing into the stomach, it's my stomach that's just expanding, and my chest, the rib bones do not expand. So I'm gonna go back a little bit. So when my stomach expands a lot too, my air just goes forward, and it also, surprise, surprise, leads to more of an anterior pelvic tilt. My back arches again, right? So, you know, what I used to be doing is chest breathing or stomach breathing. And that's what I gave to my patients a long time ago. I realized that's not the thing that builds us anymore. You actually have to get all of it in a sense, right? And we're going to talk about in the section that, you know, what can we do about that? So these are just pointers. If you've never, you know, if you've been doing a lot of chest breathing or just stomach breathing because it's good for you and you're not getting necessarily better, these might be the reasonings. I'm not saying that's the wrong thing. I hope you know that, but it could be the reason that's missing. You're just missing something, right? None of the things you've done before is not wrong, but it might be missing the things that might be leading you to a better position. So, number 5, common walking patterns. All right, I'm going to talk about common walking patterns because these are things that happens. So first is the regular walk, right? My arms are swinging, my hips are moving back and forth. It's kind of shifting back and forth. I'm going to kind of, and then I'm going to be doing 3 different types of walking patterns, and I hope you can relate to it if you have it. If you don't, don't worry about it. Number 1 problem is head and your back kind of leans. If you ever see lean walk, so you kind of, your head, see that person walk, you don't know. And if you see that walk, you notice how the, so I just take, hold on, let me go back to it. Right. If you've seen the walk just now, you can notice how my head bobs back and forth, but I don't load into my hip. My hip just stays tight. So my hip is like a stick. So my hip never gets to stretch, right? Number 2 is a person that has their toe out when they walk, right? So when I have my toe out when I walk, what happens is my front of my hips open and my glutes get squeezed, so my hip kind of gets jerked forward when I walk. So notice how I walk. There's like a sway. It almost looks like I have swagger, not that I ever do, but there's like a swagger walk to it, right? But because if you walk with your toe out all the time, it doesn't necessarily mean it's a good sign, right? And then one last one for now is one side hip shift. Is when you have when you take a look at my, I'm just kind of faking it in a sense, right? Is if you take a look at in this video here, my right hip gets like jutted out one side and my left does not. So one side gets, in a sense, possibly overstretched, or other side doesn't get enough stretch. All right. So these are some common things that happens that leads to these issues. Right. I hope the videos help. I hope, you know, because I am very clinical and sometimes a little too scientific, but I hope these videos are helping. Right. So before we get into some of these things, some of the simple things that we can do for you guys, we're gonna do a little Q&A right now. If you have any questions further about what we just saw, feel free, so I can kind of maybe answer a little bit more as I go. So does anyone have any questions? Danny, was there any questions in the chat?
Yeah, Kento, we do have a question from Stacy, and how do we undo the app over gripper? And I think also Angelica agrees with that or relates to that. So maybe if you want to expand it now or at the end of it, it's up to you.
Yeah, so that's a great call. So the exercise that I'm giving you is addressing that, but there's basically specific cues to work on that, really. So it's a weird thing. The ab over gripping. So let's say Stacy or Angelica. Let's say when you try to activate your abs, you feel the six-pack act immediately. So the weird thing that I tell people with this is when usually when you breathe out is when you kind of want to activate your abs. But I tell people to kind of relax your abs as you exhale and try to activate, like do a plank. Because when you do that, it will not activate the stomach, the six-pack ab as much, and it starts to activate your obliques. So I'm just kind of giving you a prequel of a cue right now, just in case when we get to the exercise, you'll know what I mean. Because many people, when they exercise with their abs being tight, they kind of hold their breath and go, and then their six-pack ab is really on. Or when they breathe out, they're kind of go, like they're very, very strong in their air. Sorry if I just was very unpleasant with my voice just now. So in the beginning, what I tell people is making sure when they breathe out, it's kind of like this lighter exhale. If you ever kind of done like a fogging up material, like you want to like kind of fog up like a mirror or fog up your glasses. Those like the light air coming out helps you activate the deep core muscles. You'll be surprised. You might not feel it as much, but it'll at least keep your stomach, your six-pack ab working less, and the bigger muscles that are supposed to support you helping out.
And Kento, I think we have an additional question from Judson. He recently developed a classic hernia, and he wants to know if that might be related, any relationship with what we're talking about to that.
Yeah, so perfect. So there's kind of different types of hernia, so it would be very helpful if I know which type of hernia you might be going through. I don't want to be too diagnostic, but there's inguinal hernias, there are hiatal hernias, there's different types. So I'm going to assume, because it's related to here, is possibly inguinal hernias or hiatal hernias. So if it's hiatal hernias, you're definitely having some issues with your deep core as well. More directly, if you're talking about inguinal hernias, I'm going to say hip and core is interrelated just because of where the aspect is. So when individuals are over grippers, you definitely will have a tendency to have hernia, mechanically speaking. It doesn't mean that you will, and I don't want to scare anyone, but mechanically you might be a little more exposed to it because you might be really strong in your six-pack abs, but the oblique sides are not really working. Right, so those areas can be more vulnerable, and those areas where the obliques are working, those areas can be a little bit more vulnerable to hernias. So if you have specifics, I'm happy to discuss a little bit more. So these are great questions, guys. But make sure you give me more at the end as well. Danny, anything else so far?
No, I think we have that for now, and I think I absolutely agree with you. I think it's all about the integration of the six-pack or the eight-pack, like you called it, and the rest of the core, and not just the front. Utilizing the whole core. So I think I absolutely agree with you.
Yeah,
but I think we don't have any more questions yet for now.
Right, that's perfect. That's perfect. And if you guys need like a more visual feedback with it, because I feel like I'm talking more clinical, and I'm sorry if I am. I'll bring out like an anatomy app for you guys to kind of make sure you can see it better. Oh, got it. I have one more from Stacy. So when she exercises, she feels a click or pop. Not sure what could that mean. If I'm being honest, Stacy, I'm not sure what it could mean to you right now. And not sure quite yet. The easiest thing to say, let's say it's in the front of the hip. Sometimes if you ever heard the psoas muscle, or the hip flexor muscle, that might be the thing that's kind of going over, kind of like a bursa, all right, clinically speaking. But it could be many other things. There's different clicks, different types of clicks in the hip, excuse me. right? So that might be something to look into a little bit further. All right. So without further ado, let's go into the 5 simple tips to start changing your habits. So these are 5 simple ones. This is me just kind of giving you guys a start, right? Well, not you guys, for those that kind of relate to what's going on, this is a start, right? These are simple but challenging for all of us, right? I got a lot of videos for you guys. So number 1, if you are a glute clencher, you're a butt clencher, right? If you are a person that tends to squeeze your butt, imagine you squeeze your butt so much that you're imagining there's like $300 bills in between your butt, your cheeks, and you don't want to let it go, because right now with COVID going on, I wouldn't want to let it go either. However, if you want your hips to be better, you need to let those things go, right? That was a bad joke, wasn't it, Danny? I'm sorry about that. So let's keep going anyway. You're going to, So to activate your inner thigh is a very, very good idea. So let's go right into it. So activating your inner thigh is a very good idea. And when I say inner thigh, it's not the inner thigh by your knees. It's the inner thigh by your hip joints. So I'm going to kind of play a video here. If you've ever been treated with me, you may have done this exercise already, which is fine. Videos, I have it unlisted. And if you guys are interested in these exercises, if you guys are interested, just put it in the chat, and I'm interested. So inspired by the Posture Restoration Institute, awesome place here. And this is you lying on your side. You have like a bowl or pillow in between your knees. This is such a subtle movement. So I want you to take a look at here. When you're positioning your body, you're making sure you're not arching your back, but you're just slightly over each other, meaning like you're just relaxed and stacked over. When you're ready, you're going to press your top thigh into the ball, not both thighs, just the top thigh. Right, I'm trying to be a mime here. So press the top thigh into the ball. And then as you're keeping the pressure on the ball, you're pulling that pulling that ball towards your hip. So if you took a look here, I'll put the pen here, into the ball. Once I keep that pressure, I go and pull my hip backwards. Why is that important? It's not because I just want to turn on the inner thigh just because I want to. It's because there's a muscle up here in that hip joint that helps me center my hip bone into the hip joint. That's what we're going for here. So when we can get that the thigh muscles that's really topped by the hip bone, it tends to center the hip bone better. And once that's done, you got to do different things with it. But it's a very good start, especially if you have your butt clencher and you have outside hip pain. This can be a game changer for your hips if you've never done any type of top, like really upper inner thigh work. So these are a great exercise if you've never done this. If you've been treated by me, you probably have done it. And I probably have, if you cramped up, I might just say, hey, that's great. I'm glad that you're cramping up, if anyone relates. So that's the drill that you're doing. And Danny, I see some chat, so if it's seen something that needs to be answered now, let me know.
I mean, I think we can. I mean, we have something related to the same thing, the popping, like you're saying, like centering the joint or putting the joint back in place. And then so Nathan was asking when doing the exercise, he feels a pop or hears a pop, and now it's getting so common that it's actually cracking. So he wants to know what is going on, and I think you were going over a little bit. But also, actually, Judson actually tried the exercise and he felt great. He just
right. Yeah. Absolutely. Nathan, when load the leg with your exercise, my hip joint hurts, pops. Oh, right. This is a Nathan that I know, Nathan. Okay, Nathan, I think we need to just talk privately on this one. I don't want to expose anything too much here. But sometimes when the person's hip joints are out, often when we load the drill, lower the hip the way, let's say I load it or Danny loads it, it sometimes pops back into place, and it's a weird feeling. If you ever experience it, just go, and afterwards you're scared for those moments, but after years you don't feel bad. If it continues to pop out, that means there's habitual stuff that leading to pop it out and pop it back in. Not in the sense that it's really popping out. You're just kind of in this joint and it's just kind of moving back and forth and it's not smooth. That's pretty much what it means. So, you know, Nathan, I think we need to talk privately because it's been a while since I've probably seen you or talked to you. So, and I hope you're doing well, by the way. At Dr. Polmack, I think I have more, right?
And I think we have one more question. How long, how many repetitions or how long do you want the hold for?
Okay, so it depends. I usually tell people you want to hold it for about 4 breaths and you want to do it for 4 sets. That's what I usually tell people. But really more importantly, I tell people do whatever you can handle in the beginning. Remember in the secrets in the beginning when I said everyone learns differently? That also means everyone learns differently when it comes to amount as well. Because sometimes the changes are so different. Because what we often are scared as human beings is change. We are scared of change, not because it's, you know, not because you don't know what's good or bad, right? You've heard the term for a lot of people, and myself included. I say, I know I should eat my carrots today. I know it's going to be good for me. I know I should, right? But I don't do it, right? Maybe because your mom or dad forced you to eat it and said, you're going to eat this carrot, right? But so you're resisting, right? So for some people, we know that it's good for you, but we don't kind of do it just because of how you learned. And it's not a wrong thing. You just have to know it. So Anya, I'm just making this such a long answer for you, but the point is, if you can only do it kind of 1 rep and you really feel it, just do 1 rep and take a break and do another one tomorrow. I recommend 4 breaths, 4 reps. However much you can do. And then you work from there. I hope that makes sense, and I hope that answers something.
We have one more question related to this exercise. Should we do both sides or just the sore side? Or
both.
When that hurts. Exact. I agree.
Yeah, definitely both. Definitely both. Because assuming that I don't know what's going on right now, I would do both sides and see which one seems to be harder, and just note that. And the side that's harder is probably the one that you want to work a little more, but slower, right? And tissues take time to change, so you need to kind of do this on a repetitive basis if you can. And when I say take time, just go even one rep a day or 0.5 reps a day. I don't really care how slow or how much you do. I would say it's more of that, even though you might not do a lot, but it's kind of in a fairly consistent basis. And that's what I would say the best medicine would be. So these are great questions, guys. Amazing, amazing. Number 2 is the breathing exercise, right? If you hate breathing, I mean, you knew it was coming. If you were watching me just now, you knew breathing was coming. So I forgot who it was. I think it was Stacy that was the overgripper, or asking the question about overgripping. Breathing is the first thing to do. So in this video, excuse me, I'm talking at the same time. I wrote down what exhale not to do. So first, if you exhale and you tend to suck in your stomach only and not your rib cage, not a good sign. Don't forget your lungs are inside your ribs. Or if you stick your stomach out when you exhale and nothing moves, right? Those are not good as well. So what I tend to tell people, most people, they don't move their rib bones when they breathe out. They're breathing, but they're like their neck is really tight and their stomach just keeps moving, but that middle right here, the chest bone here is not moving. So that's a key point. So when I tell people, when you first breathe, I just want you to learn how to breathe out and move the chest and ribs down. And to do that, and this is the key point for the individual that asked about the overgripping, is if you look in the video here, the cue is to exhale with a sigh to keep your neck relaxed, right? So this might be too much information, but if you're an over ab gripper, there's a very good chance your neck is also really, really tight, or just tight, right? Really tight. I'm just being exaggerating, but it's probably tight. So if you exhale and sigh, your neck relaxes and your rib bones can go down a little bit more. That is a good start. There's more to it, but this is the start for you guys, right? And then once you feel all the way out, once the rib starts to go down, that's when you can start feeling the abs turn on. But most of us, when you breathe out, the ab turns on like this. Instead, you need to feel the abs go down and then the ribs, the stomach or abs to turn on. Did I say that right? Breathe out, ribs go down, and then the ab turns on. Not ab turn on, the rib go down. Not that way. You kind of want the ribs turn on to go down, then ab can't turn on. I hope that makes sense. We're getting a lot of chat here. I don't know what's, I'm not checking. So number 3 is breathe, get your breathing better more. Don't worry, I'm not going to do another third time. This is just the only second time. So breathing part, number 2. So this is the same video. I'm going to the second half. Is once you learn how to exhale well with your ribs going down, the inhale is going to be the game changer in the end. So if you remember with the body habits before, when you inhale just with your chest or just with your stomach, you will probably create some form of compensation in the long run. It's just how it is, right? Because you're just doing one spot and your ribs are not moving. So what you want is once you get there, and if you kind of can take a look at it, is when you inhale, it's such a subtle movement, I'm sorry, so you might not be able to see, is your chest, rib bones, and your stomach kind of expands together. So it looks smaller, but the whole thing expands. So notice when I exhale, you can see all the rib. When I inhale, the whole thing expands, rib go down. And you might not be able to see it quick because it's happening on this whole thing expands and it could be a little slow. So I'm looking to have people, when they learn how to inhale, again, the chest, their abs, their stomach, your rib cage expands as a whole, and their back also expands as well. So when that happens, great things happen. It's not easy in the first, like when you haven't done it in a while, or when it's just kind of new for you. But this is also great for backs if you've never done it before. Not an easy thing to do, but I'm just giving you that are new here, just these ideas and cues to give you some things that maybe hasn't, this piece of the puzzle wasn't there quite yet in the past. Danny, I'm seeing like 11, 12 chats here. Is there a lot going on? We're okay? All right, go back.
All good, all good.
All right, it's in the end. Anyway, let's keep going. We're at number 4, right? I hope you're getting something, guys. I really hope so. There's videos. I did a lot for you guys, for myself and for everyone else. Number 4 is work on your hamstrings, especially the hamstrings by your buttock area. Right. So if you're a glute butt clencher, or if you're in your ab over gripper, these are great exercises. Because if you're an ab over gripper, there's a good chance your hamstrings are not helping you kind of tuck your pelvis. If you're a glute over gripper, your hamstrings are not helping you tucking your pelvis. So this is a drill. Same thing if you guys want it. I'm happy to email it to you guys later. It's like a little folder just for you to get through. I did like closed captions with it, so I'm gonna kind of go through a little bit more because so I get to the point very quickly. You put your feet on the chair. Your knees are going to be, knee and hip is going to be in line, and you're going to dig your feet and feel your hamstrings activate. Not your glutes, but your hamstrings. Right? Try not to squeeze your glutes, and you're going to try to kind of tilt that pelvis off the ground really little bit. So right now I'm already lifting it, and if you can tell, I didn't actually lift the pelvis. It's like a tilt with my hamstrings. If you can tell, my glutes are not squeezing, and I'm just getting my hamstring up here, right? So hold on, I'm just kind of driving here, right? My hamstrings, so I'm digging my heels into the chair, and my hamstrings are kind of peeling my pelvis off the ground. Notice that my glutes, if you can see my glutes, right? My glutes are not squeezed, right? Because if I do, I'll tense up my back a whole lot and my hips as well. Right, so this is a drill for your hamstrings to help you activate it. right? And the reason I'm talking about hamstrings is if you have a very tight hamstrings, there could be multiple reasons for it, but a pattern that we often see is the glute, your abs or back are over gripping too much. So we're just activating muscles that we tend to not see often or work often. Okay. Number 5, last one. I made it the simplest, hopefully, on the last one, is swinging your arms when you walk. So if you're walking right now, right? So with COVID-19, and we're kind of more aware of our surroundings, and you know, if you're out in public and you have to wear a mask and you're just kind of worried about so many people coming, you know, not social distancing or maybe just kind of spreading a lot of viruses, you might be a little more tense when you walk, right? So your arms might not be swinging as much. And when your arms are not swinging, your chest bones and your rib bones are not moving as much, which affects your hip. So I wanted students to see how in the video here, I might not be the best example because I've been working on my hips and swing a good amount. So it was hard to shut down, but I think you'll see the point here. So in the first one, I don't have any arm swing. So my hips are still moving, but it's not as strong. It's not shifting as much. So I'm purposely not moving our arms. And then I'm telling the camera, I'm going to start moving your arms more. And when I move my arms, can you guys see how the hips go back and forth a little bit more? When I move my arms, like when I use my arm swing, it helps me shift my weight from left to right, right to left, right? This is a beautiful thing. And then if you just saw a little bit at the end, one of my patients just walked in on me. Not on, she didn't walk in on me. She walked in and I was just scared. So if you look at me, have this immediate reaction that I may do kind of like a Dragon Ball Hadoken or a karate chop or something like that. I was ready. I wasn't ready at all. I was very scared. But anyway, off to that point, coming back, if you are not swinging your arms, and if you notice you're not swinging your arms, especially forward, not backward as much. A lot of people do backwards, not enough forwards. This might help your hips. Or individuals that have back issues. I bet most of you, especially if you have a hip tightness or back tightness, your arms go backwards, not forwards. That's a key point, especially if you're not like a clinician, just as a layman's terms. Arm swing forward is a very good thing to do. Last bonus, I'm giving you a little bonus here, right? Wow, you guys held on a lot. We've been going through an hour, so I really appreciate you guys staying around. Last thing is ankle. So if your ankle, if you're having hip issues and you have ankle issues in the past, I want you to check your ankle. Do you know how to arch your ankle up, or is it stuck to the point that you can't flatten your foot? Right? Can you arch it up? Can you flatten your foot? By understanding that, or when you have the ability to do that, you will affect how your hip works. So if you don't know how to do that, that could affect your hip. You know, your hip might be so good that it might not be affected, but most people, when their ankle is stuck in the same position for a very long time, it does affect axis of how they move the hip. Okay, so that was a lot, guys. I hope you got something out of it. Even if you got one or two things or two or three things, I'm very thankful. I hope you got something out of it. That's the point of it, and I put a lot of content into it. But know that this is a tip of the iceberg. Tip. Because there's just so much under the reasoning behind everything. So that's what usually allows you to progress a little further. But I hope you got something out of it today. And if you are if you're kind of new, or if you're kind of like with me already, but you haven't seen me in a while, if you are really serious about improving your chronic hip pain, I just kind of give you this 30,000 feet idea a little bit just now, just to give you some ideas. But if you want to know, if you're new and if you've never been with us before, if you want to know what Kamiyama PT can help you with, and if you are a person that wants to know what's actually going on with your issues, I would actually just apply to chat, right? So at least we can help you to see what's actually going on with you, or give you at least a direction and why. We don't have MRI eyes, or we don't have X-ray eyes. I mean, I wish I did. I mean, my name is Kento, and Clark Kent had X-ray eyes, but you know, we can, through our experiences, give you a pretty decent idea of what's actually going on. So let me just put this link for you guys. Hold on for a minute. Hold on. Give me 1 second, guys.
I can put it, Kento. Don't worry about it.
Oh, perfect. Thank you, Danny. Thank you, Danny. All right, so let me just go back to it then. It's in the chat. Okay, so Danny just put this the chat. If you are interested, just apply for it, and then we'll contact you as soon as possible with it. Especially if you want to know what's going on. And this is just chatting with us. Nothing. We don't want to sell you anything. We're just going that for just to help you guys. And if you want to take it one step further, these are the individuals that were very serious about what's going on, because I don't want to work with people if you're not kind of serious as much. And apply for kind of like a virtual discovery visit. This is a visit where you get to ask a lot of questions, like in person or virtually if you're in New York, Connecticut area, and New Jersey. Anything outside, we have to rethink about that legally at least. But we will do like a gait assessment, like a walking assessment, and more of a specific orthopedic assessment for you guys. And this is usually great for those that want to know what's actually going on with them, right? They're not sure what's happening, and they're very serious that they just want to get it over with, not get it over with, but they want to seriously improve and progress. These are something to do. So it's a limit to 3. I might have changed the numbers lower, but in the survey, I think it said 5, but it's limited to 3. And it's just kind of first come, first serve. So more than welcome if you guys are into it. And this is the last one for me. If you're seriously serious, and I said seriously serious, this is apply for a competent evaluation session. So this is kind of the last part, like, you will get the virtual or in person. This only for one person only if they are, because I want to see if they are, and then you go from there. But do not apply if you're not serious about it. If you are serious, let's work with it. And for those that has worked with me, I hope I show that I care, and we do the best we can to help you guys as much as possible. So the link is in the chat. You guys are more than welcome to stick around. So last thing, I'm happy to answer any questions and answer for all of you. If you liked it, if you guys have Instagram, that's our thing. Just kind of tag us if you can, if you'd like to. But if there's any further questions, I'm happy to answer. So Danny, I think you had a lot, right?
A lot of requests to send a video, so we have the name, so we're gonna send them later on.
Yeah,
and
yeah.
A lot of compliments to breathing techniques that you showed before.
Oh, great.
Yes, so that's some of the questions or requests that we got in.
Got it. Good. Does anyone have any questions? They're more than welcome to stick around, and I can answer any question. You can unmute yourself or put more questions in the chat. I am just reviewing. Let's see. Just click. I'm just going back up.
Nate, we have one for tight hamstrings. Do you recommend stretching? Big question there.
Oh, that's a good question. So yes, in a sense, but tight hamstrings are usually not tight hamstrings. That's not an answer. But what I mean by that is it's a muscle that doesn't know how to slide. So if you just stretch a hamstring for hamstring stretching's sake, it doesn't do very well. So if I have to choose, I bet that's Nathan. I knew it was Nathan. It's if you have to choose, excuse me. Hold on. Where am I doing here? Pointer. Hold on, guys. Okay, here we go. If I had to choose how to stretch a hamstring, is you got to make sure your deep core muscles are actually on as you stretch. Okay. So let's say you do a hamstring stretch and you're just kind of stretching for stretching's sake and nothing's on. It usually doesn't do well. So when another way to explain it is a muscle doesn't want to stretch when something in the middle, more in the core, doesn't feel stable. So what I tend to do for people is I kind of activate the core kind of reflexively and they stretch the like kind of work on their hamstrings. And then after that, their hamstring actually sticks, like flexibility sticks better. So if you are having trouble with hamstring tight tension, activate your core as you stretch the hamstrings. Okay, I hope that answers some of it. Good. Any other questions thus far? I'm gonna actually unshare so people can see me. Or I'm sure they were able to see me before. So is there any other questions? I'm seeing, I'm seeing other people now, which is great to see. Nice to see some of you. That's nice to see. Any other questions, guys? Any burning questions about your hips or breathing or groin or, I mean, I said so many things. Oh, I see come. Hold on. Oh, I saw. Thank you, thank you, thank you.
I think they're just absorbing the information, Kento. They just like
yeah. That's good to hear. That's good to hear. And I'm assuming some of you want the replay, so I'll send you guys the replay. But yeah, that was good. I think I said a lot. I don't know if that's a good thing. I don't know if that's a good thing. Yeah, let's do the replay. Gwen, thank you. I'll send the replay because sometimes if there's no questions at the end, it's either I did a really good job or I did a really bad job. So that's never a good. I have no idea.
Well, we'll see. Well, we'll see later.
Yeah, we'll see later. Okay, Danny, anything to add on to before we finish off?
No, I want to thank everyone for coming, and I do have the list of who wanted to the replay of the videos, the little exercise videos. So we will send you guys those soon.
Great. So yeah, for those that wants the videos, that it's on YouTube, but it's unlisted. So I'll just send you the link to the actual the folder, and you guys have it all. All right. So thank you so much, everyone, for coming. We'll probably have a different one in a month or so. We're just trying to make it more quality based. We've been doing like once a week, once the quarantine started, but we're just trying to make sure we just get it more quality and a little bit, let's say, different. So have a great night, everyone. Thank you so much for coming, and I'll see you guys soon.
Thanks for watching this video. If you found that helpful, and if you now are thinking that I wonder what else this person can help me with, please go to our website at www.kamiyamapt.com and find other free contents or apply to our free discovery visits to further see if we can help you. For any further information, please email us at info@kamiyamapt.com. Thank you so much.